Namaste. Welcome to Try Yoga for Health. Today's program is about yoga for lower back pain. Lower back pain afflicts between 70 and 80% of all adults and is the fifth most common reason for physician visits in the U.S. It's said to cost between $20 and $56 billion per year in medical costs, depending on which study you read. And there are few effective medical treatments. A fairly recent Boston Globe article entitled "Living with Back Pain" quoted Dr. Stephen Atlas from Mass General Hospital as saying, "Back pain, unfortunately, isn't something we're very good at treating." Conclusions from a 2011 study of 313 adults with chronic or reoccurring lower back pain showed that a 12-week course of yoga was more effective in treating back pain than common medical care. I think one of the reasons yoga is so effective for lower back pain is we focus on three things. Number one, expanding awareness, especially expanding awareness on alignment, which can be a cause of recurring and chronic lower back pain. Number two, strengthening core and lower abdominal muscles and stretching, so we have it all. Alignment is very important. Our skeleton has three primary curves: behind the neck, the cervical curve, behind the shoulders, the thoracic curve, and in the lower spine, the lumbar curve. And when the spine is aligned, these curves allow all the force to be distributed evenly through the body without strain. When we slouch or curve or compress, we force the muscles to hold. That could cause a lot of muscular pain. It also compresses the vertebra, which can cause discs to bulge and press on nerves. So alignment is the number one important thing to do for lower back pain, especially standing and sitting. So let's start with our standing alignment. You can lift the toes and bring your awareness to the feet on earth. Feel the earth evenly between the balls and heels, inner and outer feet, and then you can release toes toward earth, grounding. Soften the knees. Draw navel toward back of spine, engage your core strength, ground from hips down. Lift and lengthen from hips up, decompress the spine. Shoulders open, sternum lifting, head in alignment. If the head's too far forward, it causes strain on the neck. Too far back, it compresses the back and neck. It should be balancing on the spine. Now bring awareness to your breath, breathing in and out through the nose. Breath slow and steady. In your next exhale, follow the breath out. Inhale, expand the abdomen. And on the exhale, gently press navel toward back of spine. This will help you expand on the inhale. Keeping breath slow and steady. And on your next exhale, follow breath all the way out, pressing navel toward back of spine. Inhale, complete breath. Expand abdomen, rib cage, upper chest. Fill lungs to maximum capacity. On your next exhale, fully release all the air, pressing navel toward back of spine at end of exhale, continuing with complete breath. Breath slow and steady. You can add the sound of victory breath, Ujjayi breath. With the mouth closed, whisper the sound of Ah. On the exhale with mouth closed, whisper the sound of Ha. Continuing with Ujjayi breath. Maintaining awareness on breath, maintaining a slow, steady, even pacing of the breath. On your next exhalation, follow breath all the way out. Inhale, upward salute, palms face forward, open heart, shoulders draw back, lift arms overhead. Exhale, earth touch, engage abdominal muscles, hinge from the hips. Keep the spine lengthened. When parallel, hands release to earth. If you need to, bend the knees. And then release lower, mid, upper spine. Pause for the inhale. Exhale, roll to standing. Soften the knees. Press navel toward back of spine. Roll vertebra by vertebra. Shoulders come above hips. Inhale, upward salute. Open through the heart. Arms come overhead. Exhale, earth touch. Press navel toward back of spine. All forward bends should be done with the spine lengthened. Not rounding the shoulders, not dropping the head. We come into position, then release. One more time. Exhale, roll to standing. Inhale, upward salute. Exhale, earth touch. Engage your core strength to maintain that length from tailbone to crown. Hands into position, then release. Lower, mid, upper spine. Bend your knees as much as you need to. Inhale, monkey. Lengthen from base of spine. Bring hands under shoulders. Exhale, mountain. You can lightly leap back or you can just step back one leg at a time. Bring hips into position, then release. Lower, mid, upper spine. Pause for the inhale. Exhale, cat tuck. Tuck chin. Press navel toward back of spine. Bring shoulders above wrists, knees to earth. Inhale, cat. Lift tailbone, roll through spine. Open across shoulders, lengthen through neck. Pause in cat. Make sure we have correct alignment here. Shoulders above wrists. All parts of hands on earth in Bhu Mudra, Earth Mudra. Knees slightly behind the hips. And natural curves of the spine. There's a slight extension of the neck. Don't lift the chin, never compressing back of neck. And don't sink so far that shoulders are coming in. Create space across the shoulders. Keep sternum lifting. Exhale, cat tuck. Tuck the tailbone. Press navel toward back of spine. Roll vertebra by vertebra. Head releases last. Inhale, cat. Lift tailbone. Roll through spine. Open shoulders. Lengthen through neck. Exhale, same length as the inhale. Move vertebra by vertebra. This is engaging some core strength. It's also bringing awareness to each and every vertebra through the spine. Bringing circulation to each joint through the spine. Moving synovial fluid into the discs. Move with your breath. Try to bring your awareness to each and every vertebra. Head is moving last. It's just taking a ride on the spine. The next time you inhale into cat, pause. Exhale, child. Bring hips straight back. Release the toes. Lead with the tailbone. Engage core strength. Dissolving hips to heels, chest to thighs, forehead to earth. Pause for inhale. Exhale, cat tuck. Tuck chin, press navel toward back of spine. Lift hips, bring shoulders above wrists. Inhale, cat. Lift tailbone, roll through spine. Open through shoulders, lengthen through neck. Exhale, child. Press navel toward back of spine, maintaining the alignment, dissolving as hips come to heels. Feel the wave come from base of spine to crown. Pause for inhale. On the exhale, wave begins at top of spine. Chin tucks, really press navel toward back of spine as you lift hips. Come into the tuck, then roll from base of spine up. I found this movement to be very effective, especially for back for back spasms and back pain. First thing in the morning, you wake up, you're all stiff. Bring some movement into the spine. You do this as many times as you like. Next time you come into cat, pause. On your next inhale, basic slant, pull the hips forward. Press navel toward back of spine. Exhale, face down, just bend elbows. Thighs, hips, chest, forehead come to earth. Inhale, prep half locust. Bring chin to earth. Slide hands straight back. Lift hips, placing palms under thighs. Right side, inhale, half locust. Lengthen from hip to toe, lift right leg towards sky. Exhale, slowly lower to earth. Left side, inhale, half locust. Extend from hip to toe as you lift, then lower. Exhale, same length as the inhale, continue alternating sides. It doesn't matter how high you lift. Make sure you keep the legs straight. Lengthen from hip to toe and then lift. Don't bend the knees at all. You want to engage the hip extensors here, strengthening the lower back muscles. You should feel this lift coming just below the waist. Lengthen out, then lift. Slow, steady breath. Keep the legs straight as you lift and as you lower, moving with your breath. The next time you release left leg to earth, pause. Inhale, press pubic bone, navel, chest to earth. Lengthen through back of neck. Exhale, turn head to left. Tuck the left toes under. Right side, inhale, half locust asana and sustain. As we sustain, allow the exhale to become twice as long as the inhale. Slow, steady breath. With each inhale, lengthen from hip to toe, extend out. With each exhale, try to lift a little higher. Breathing in and out through the nose. Slow, steady breaths. You can hold this for up to 10 breaths. When ready to release, on an exhale, slowly lower right leg to earth. Slide the left toes out, 5th, 4th, 3rd, 2nd, 1st. Inhale, press pubic bone, navel, chest to earth. Draw chin in, lengthen through back of neck. Exhale, turn head to right, left ear to earth. Slide the right toes under, left side. Inhale, half locust and sustain. With each inhale, lengthen from hip to toe, extend out through the leg. With each exhale, lift higher. Breath slow and steady, very strengthening for the lower spine. No strain, no compression. Breath slow and steady. Now we gradually build up. So if you're just starting out and the muscles are weak, you wouldn't hold as long. You don't want to strain the back. Afterwards, you can hold for a long, long time and strengthen even more. When ready to release, on an exhale, slowly lower left leg to earth. Slide the right toes out. Sustain face down rest. Head remains toward right. Lift hips slightly, releasing palms to side. Palms facing up, 1st and 2nd, fingertips touching. Completely melt into the earth. Let go. On your next exhalation, face down. Press pubic bone, navel, chest to earth. Draw chin in, bringing forehead to earth. Slide hands under shoulders. Hands in Bhu Mudra, all parts of hands on earth. Elbows close to rib cage and off the earth. Inhale, Cobra One boat. Lengthen in both directions and lift legs, chest, and head. Exhale, slowly lower to earth. And continue, Cobra One boat. Inhale, expand in both directions and lift. Exhale, slowly lower. When doing any arching, it's very important to engage the legs as well. The legs should be extending back as the spine lengthens forward to prevent compression in the lower spine. So as we arch, We want to create space from base of spine up. Gentle arching is one of the most beneficial postures for bulging discs and lower back pain. The next time you inhale into Cobra 1, sustain. As we sustain, with each inhalation, lengthen in both directions. With each exhale, lift a little higher. Shoulders back and down, sternum lifting. Don't compress back and neck. Don't try to lift chin up. Long, slow breaths. Try to hold for at least 5 complete breaths, longer if you feel stronger. When you are ready to release, on an inhalation, boat, roll to outsides of hands, first and second fingertips touch, arms extend back. Exhale, face down, rest. Release arms and legs to side. Head turns to left, right ear to earth, and melt into the earth. Completely relax. On your next exhalation, face down. Press pubic bone, navel, chest to earth. Lengthen through back of neck. Bring forehead to earth. Slide hands under shoulders. Elbows close by sides and off earth. Legs extending back. Inhale, Cobra 1, lift. Press pubic bone, navel, chest to earth. Lengthen through chin. Lift from base up. Exhale, lower. Continuing, Cobra 1 lifts. On the inhale, lengthen out and lift. Legs extending back as spine lengthens forward. Now you want to lift from base of spine up before you lift the chest. The head is taking a ride on the spine. It's not about lifting the head up and down. That's just a movement for the neck. We really want to move from base of spine up. The next time you come into Cobra 1, sustain, legs extending back, spine lengthens forward. If there's any strain in the lower spine, you can turn the heels out to the side, creating more space across the lower spine. You can also have a small pillow under the abdomen. With each inhalation, lengthen out, legs active to create that space in the lumbar spine, shoulders back and down, sternum lifting. On your next inhalation, half boat. Roll to outsides of hands, first and second fingers touch. Arms extend back. Exhale, face down, rest. Release arms to earth, turn head to right, left ear to earth. And release. On your next exhalation, face down. Press pubic bone, navel, chest to earth. Lengthen through back of neck, forehead to earth, hands under shoulders. Inhale, Cobra 2 lift. Press pubic bone, navel, chest to earth, lengthen through chin. Pass through Cobra 1, then press hands into earth, lifting only as far as comfortable. Exhale, lower down. Flowing with your breath. Lengthen out and lift. Head is pretty quiet in the lift. And don't try to straighten the arms. Look what happened to the shoulders. No opening or lifting, pubic bone coming off earth. So for most people, elbows will remain bent. Now, if you have any strain in the lower spine through this, you can use a small pillow right under the abdomen, placing the edge of the pillow by the hips, and out and lift, only lifting as high as comfortable, all parts of hands on earth. Exhale, lower. Shoulders back and down. On your next inhalation, roll to outsides of hands. Inhale, half boat. Exhale, face down, rest. Arms to side, head looks to left, right ear to earth. Completely relaxing on earth, letting go. On your next exhalation, face down. Press pubic bone, navel, chest to earth. Lengthen through back of neck. Bring forehead to earth. Hands under shoulders. Inhale, extend right arm overhead. Exhale, bend the left knee. Bring right shoulder to left hand. And left foot onto the mat. Roll onto the spine. Inhale, partial recline. Bring right foot in. Exhale, knees to chest, arms circling around. And stop. I have to move this microphone. Okay. You can gently rock side to side, front to back, make circles with the knees, gentle movements to massage the spine. Then slowly allow movement to subside. Lengthen spine along the earth, open across the shoulders, lengthen through back of neck. Gently press the thighs toward the chest. Inhale, prep, recline, twist. Extend arms out to side in T. Keep knees and feet pressed together, navel pressed toward back of spine. Exhale, knees and feet to left, head turns to right. Keeping knees and feet together, they can come to a block or a hand. Pause for the inhale. Exhale, roll onto spine. Pause for inhale. Exhale, knees and feet to right, head turns to left, keeping them together. Pause for inhale. Exhale, roll onto spine, moving with your breath. We're pausing for the inhale, moving on the exhale, engaging the core strength, keeping knees and feet pressed together. The next time knees and feet come to left and head turns to right, sustain. Now bring knees and feet all the way to earth. If the knees are separated as you come to earth, place a block or a pillow under the left knee. Both shoulders on earth. If the right shoulder's lifting, press left elbow into earth. Release that left shoulder blade. Head looks over the right hand, or anywhere between sky and hand, no strain in the neck. To deepen this twist, press left hip into earth, lift right hip towards sky, lift through the rib cage, open across shoulders. As you exhale, deepen lower, mid, upper spine. Exhale longer than the inhale. All flexibility in the spine comes from creating space between the vertebrae. So we want to lift and lengthen through the spine, deepening the twist, lower, mid, upper. Spinal twists are very helpful for realigning the spine, releasing all tension through the spine. With each exhale, release all tension, let go. You want to hold this for about 10 complete breaths. When complete, on your next exhalation, press navel toward back of spine, squeeze knees and feet together, and roll onto the spine. Pause for the inhale. Exhale, knees and feet to right, head turns to left, and sustain. If the knees separate, you can have a pillow or a bolster under right knee, both shoulders on earth. Release the right shoulder blade if the left shoulder's lifting. Optionally, you can have the hand on the knee to try to bring it over, or it can come straight out. To deepen this twist, actively engage. Press right hip into earth, lift left hip towards sky, lift through the rib cage, open shoulders, and exhale, deepen lower, mid, upper. The founder of TriYoga, Kaliji, says a spinal twist a day keeps the chiropractor away. Spinal twists can be done sitting in chairs, any position. Make sure you add it to your day. Holding for 10 complete breaths with exhale longer than the inhale. When you are ready to release on an exhale, roll onto the spine, keeping knees and feet together. Arms come down by side, then bend elbows, bringing hands to knees. Once again, you can gently rock side to side. Slowly allowing movement to subside. After a twist, it's very important to realign the spine in a forward bend. We've already said all forward bends should be with the spine straight, so this is a good position for a forward bend. Lengthen tailbone toward earth, extend through the spine, open across shoulders, lengthen through back of neck. And as you exhale, gently draw the thighs toward chest. You can have one hand on each knee, hands clasped around the knees, or knees inside elbow creases for this position, whatever works best for you. And on your next exhalation, partial recline, release arms to side, feet to earth with control, toes, balls of feet, heels. Right side, inhale, prep cradle. Bring right ankle onto left thigh below knee, and make sure the ankle's far enough apart so the ankle isn't torqued. You can move it over a bit. Exhale, cradle, bring left thigh toward chest. Right hand comes between the legs and clasped on top of left knee. And if you can't reach, if the head is lifting, you can have a strap around the knee and hold on to both ends of the strap. Or alternatively, you can just place the foot on a block and gently press the right knee away from you. Keep lower spine pressed into earth, right knee pressing away. You'll feel a stretch in the hip. This is one of the most effective postures for relieving sciatica. Keep the spine lengthened as you press the knee away from you. Exhale twice as long as the inhale. Breath slow and steady. Breathing into that hip. With each exhalation, letting go. You can hold this for a very long time. When you are ready to release, exhale, partial recline. Release left foot to earth, then bring knee out to the side and foot to earth. Left side, inhale, prep cradle. Bring left ankle onto right thigh. Then exhale, right knee toward chest or right foot on block. Left hand between the legs, under calf, both hands clasping around the right knee, or you can use a strap. Shoulders open, back of neck lengthen. Lengthen along the spine here. Pressing left knee away from you, right thigh toward you. Exhale, becoming longer than the inhale, twice as long if you can. If your eyes are closed, focus inner eye mudra, the space between the eyebrows at the center of forehead. Breath slow and steady. Again, hold this for at least 10 complete breaths. And you are ready to release. On an exhale, release arms to side, right foot to earth with control. Left knee comes out to the side, foot comes to earth. Inhale, press lower spine to earth. Exhale, both knees to chest. Every transition, a core strengthener. And exhale, recline butterfly. Release arms to side, feet to earth, toes, balls of feet, heels. Bring soles of feet together, knees separate. If there's any strain in the knees or hips, you can place blocks under the knees. Arms can be down by side, palms facing up in Om Mudra. They can be interlaced at torso, or arms can come overhead. Long, slow breaths and dissolve. Make sure when you're doing any of these postures that there's no pain at any time. Our motto is all gain, no pain. You can always modify using blocks, bolsters, pillows. Don't strain. Don't really try to move so aggressively into a posture. Here, less is more. Follow your breath. Namaste.